Welcome back. You are still on to Good Morning Abuja, and another conversation beckons on the program this morning. And this time around, we are going to look at the activities of Lady Helen's Foundation, and we have the CEO and the assistant, of course, on the program this morning, and they're going to tell us a lot about the foundation and their lineup activities for today, because they have an outreach today being Thursday. Join me as I welcome Dr. Benjamin Odeka, who is the Chief Executive Officer, Lady Helen Child Health Foundation. He is to my immediate right, of course. You're welcome to the program, and good morning, sir.
Thank you very much.
We are glad to have you here.
Thank you.
All right. Next to Dr. Benjamin Odeka is his wife, Dr. Francisca Odeka. She is the Operational Director, Lady Helen Child Health Foundation. You are welcome to the program.
Thank you for having us.
We are really glad to have the both of you here.
Thank you.
Yes. Now, to start with, can you give us an insight to your foundation? Can you let us into your world?
Right. Thank you again for asking. Lady Helen Child Health Foundation was founded solely to cater for the health needs and information on research findings to improve the quality of care to children, especially the vulnerable group within our society. And in operating Lady Helen, what we have devised is a program called RAP. RAP is it's an acronym for research into children's affairs, which will improve the quality of information on their health needs. Then advocacy. There are a lot of issues relating to children, especially the vulnerable ones in our society, that would need addressing, be it policy, be it community, be it family, and be it unfortunate events that happens in disaster situations where they become orphaned or otherwise. Then we also have a third concept of patient treatment assistance, because in our context in Nigeria, we do have a lot of expectation from the health sector, and most of these vulnerable people cannot actually afford to meet their health costs. So we are looking at those aspects in our joint management of cases. So the RAP agenda is the basis of our Lady Helen Foundation, and I think it was founded about 4 years ago, and the background to that was in memory of a lady who actually looked after her children most of her life, for over 45 years of her working life, devoted to the care and management of children. And she actually enthused a lot of people that worked with her, created a lot of awareness about the needs of mothers and children, and increased the health needs and also the health agenda within government circles in where she worked in Delta State in those days, which we knew as Bendel State. Okay. So that is context in which the foundation was named after her, and I think by and by it's actually making sure that the ethos of improving the health needs of children, it's actually born. I think that's the main issue about our Lady Helen Foundation.
All right, that's very good to hear that. All right, let me hear from Dr. Francisca. That he has given us an insight to this foundation and what led to the foundation. Now, how have you been going about, getting these vulnerable children and impacting on them?
I think one of the big things that we thought we could do with the foundation is that you have a lot of NGOs working supporting children, but we felt that because of our background, I am a public sector reform expert, and I work with government and an advocate. I'm a teacher of change management. We thought we could use the foundation to advocate in the area of policy. So we actually work with government. We work with the Ministry of Women Affairs, Ministry of Health, to actually change, and also the legislature, to look at issues around vulnerability of children, issues around child health, child right. And one of the ways we do it is to actually on a yearly basis carry out lectures, conferences that will actually bring together these agencies. Because one of the things about children and their vulnerability is that when a society is having challenges, the last bit of people that you think about are children. But when you advocate, like Lady Helen Child Foundation does is that it brings children to the forefront and give opportunity for the regulatory agencies that work, for example, orphanages, that work with orphanages, to actually understand, because we work both at the policy level and also at the grassroots. For example, on a quarterly basis, we meet with orphanages, we find out what their issues are. For example, during the COVID period, even though things were being given to children and their families, there were orphanages. Children in the orphanages were no longer going to school, and they were at home. And many of the people that used to go and give things to orphanages were not able to move out because of the lockdown. So one of the things that we did was to advocate on behalf of the orphanages. So we wrote to Ministry of Women Affairs, and we wrote to Humanitarian Affairs, and so that the next lot of donation was actually targeted towards the orphanages. But I think one of the areas that Dr. Durka talked about that I think is really important is the indigent children in the FCT area. When you have a situation where a number of children go into hospitals and you have families that cannot afford to pay their hospital bills, and we in Lady Helen Child Health Foundation have a program called Patient Treatment Assistance Program, where we work with the hospitals and the social workers, and in doing that we actually have a kind of committee of lay persons, doctors, and different kinds of people that actually make decisions about who we should support. Our resources are not infinite. So, for example, when you have a child that has just been born that has a heart issues, sometimes even to get the children to do the kind of investigation that can kickstart the treatment, it's not there. So they come to us, and we also support them, like having a heart echo, so that the treatment can be started. That's a classic example. And then you also have a lot of young children are actually having kidney problems at the moment, and sometimes we have to pay. That is where the advocacy and the practical help comes in. Because if you have a lot of children having kidney problems, then you have to ask yourself, what is causing that? Because the social workers and the social welfare people are actually saying to us, there's a crisis here. What are the issues? So one of the things we do is to also advocate, not just giving treatment, looking at the preventative issue. Because if you have children that are having kidney problems, but are they some of the issues that are caused by kidney problem may be just infection, and because the parents cannot go to hospital, then to do routine checkup and have treatment, it becomes overwhelming, and the next thing, they have a kidney problem. And the real critical issue is that a dialysis costs 20,000 naira for one dialysis. So how do we put preventative measures in place that allow the children to actually, the families to go to hospital, so that you don't have this kidney problem. So one of the things that we are doing in the conference that is happening today is that at 9 o'clock today in the Pavilion Center, just not too far away from here, next to the International Conference Center. Again, this is one of our big events for the year. We are going to be bringing together all the regulatory agencies, Ministry of Women Affairs, Ministry of Health, FCT, to actually look at issues around safety of children, safety net, poverty, security. We all know what is happening with vulnerable children with schools at the moment. And today you have speakers from UNICEF, from Women Affairs, actually looking at what the issues are. So maybe I will ask Dr. Durka to say a bit more about that.
All right. Okay. Do you have an addition to what she just said? In this aspect, I want you to look at the issue of the challenges. Your challenges in handling these vulnerable children, having bring so many on board, to render assistance.
Yeah, I think the big issue is about, the first thing, the elephant in the room is finance. Okay. And the second issue has to do with information dissemination in terms of knowledge. Okay. And the third thing, the way I look at it, is about governance. So within, if you stratify most of those things that we've actually encountered, you have a child who is in need, like you rightly pointed out, a lot of these kids that actually needs either financial need, health needs, education needs, and all sorts. And the majority of them do not have access to either information, be it their parents, or finance. Education, a good classic example, because like we said, every year we tend to do a meeting, advocacy meetings, that brings policymakers to the same room. In our first meeting, we did have invitation from NEMA, education, right before COVID time, education, health, and everything, and also from the Primary Health Care Board, looking at the increased number of the mortality in children and also mothers, and that's the emergency that they declared about maternal deaths in Nigeria. So they were able to bring out a lot of information from those meetings, and it actually brought out all the difficulties. The difficulties is not necessarily governmental, but difficulty in terms of education, enlightening the people about their health needs, and also providing avenues for them to actually get those health something. They were all lacking. Then the big thing we actually found from that conference was about referral system within the system.
Okay.
From primary to secondary to tertiary. In the context of our place, you can find out that the tertiary actually does primary, secondary, and tertiary. Therefore, 70% of our primary health care, 70% of health needs actually is in primary health care. But most of these people in 70% actually go to the tertiary. So you find a tertiary institution, that's the teaching hospitals,
Overstretched.
they have no time for research, no time for secondary, because they're dealing with primary, secondary, and not doing any tertiary. It's that bad. Then the referral system within the system is more or less non-existent. Okay, so those are the issues that we highlighted in such places. So those kind of advocacy are the things we do, so that we're highlighting those things, and we actually have direct connection with the outcome of such meetings with the different ministries. We stratify them: women affairs, health. So those type of things we do. Now, you talked about the difficulties we face. Now, patient treatment. What we also found out when we visited hospitals is that some patients actually have had some treatment, but they cannot afford to pay the bills, and therefore they are kept there until they are able to pay. It is that bad. If you actually go to most of these hospitals, it actually is happening as we speak.
It is.
Okay.
It is happening.
Yeah. So you tell me, now you have a child who cannot afford to pay, blocking a useful bed that is needed by somebody that needs to come in. For no reason, he's been treated, but it can't be discharged, but he hasn't paid. So that tells you about the poor governance system within that system. Although you can't blame the institution, they have no finance, their budget is restricted, and therefore they can only act in that fashion.
So what's the way out now, looking at all this?
Okay. The way out.
How do we remedy the situation?
Yeah. What we tend to do in our context is we look and try to navigate solutions. Okay. And in navigating solutions, the frustration for us is you can come up with an A4 sheet full of recommendations, but if it's not actually carried out, then it becomes a nullity. So that is where the problem is. So when we now come up with this, the solution should be implementing it.
Okay. Time will not permit us to continue this conversation, but of course the message has been sent out to Nigerians and FCT residents in particular, because we are looking at the 6 area councils in the FCT when we talk about vulnerability. Thank you so much, Dr. Benjamin Odeka, for coming.
Thank you very much.
I must commend you for the good work you are doing, you and your spouse. Thank you so much.
Thank you for your
All right. Thank you so much, Dr. Francisca Odeka. We appreciate you so much.
Thank you so much.
Yes, good luck in your endeavor.
Thank you.
Yes. I've been speaking with Dr. Benjamin Odeka, who is the CEO, Lady Helen Child Health Foundation, and his spouse, Dr. Francisca Odeka. The program is Good Morning Abuja.